Hi, my name is Linda. In this video, I shall explore the terrible disease called multiple sclerosis. It can develop in about 2.8 million people worldwide, and is common in North America and Europe. Multiple sclerosis is a chronic autoimmune disease that can attack your central nervous system. This could be from your brain or your spinal cord. It attacks your healthy immune system by mistake, especially your myelin sheath. This myelin sheath protects the covering of the nerve fibers, which causes many symptoms from losing your balance to memory loss. In this video, I shall explore the symptoms, diagnosis, and treatment of multiple sclerosis, how you can live with this terrible disease, and much more. But first I shall explain what multiple sclerosis is. Multiple sclerosis's main problem is that it attacks your central nervous system, affecting your brain and spinal cord. It mistakenly attacks the protective sheath, which covers the surrounding nerve fibers, and is called the myelin. Therefore, it can lead to communication problems from your brain to the rest of your body. Over time, your nerves can become permanently damaged and can cause deterioration. The job of the myelin sheath is to help the electrical impulses travel along the nerve cells. But if you develop multiple sclerosis, the myelin is damaged and the impulses could become blocked or slowed down. This damage can lead to a scar on the tissue or can have lesions or plaques in the central nervous system. Your medical professional will be able to see if this is happening with an MRI lesion. Other symptoms could include fatigue, difficulty in walking, you may feel numbness or tingling, your muscles may become weak, problems with coordination and balance, and you may have issues with vision. Multiple sclerosis is a complex disease that progresses in different ways from person to person. The progression of the disease can also be over a period of time. As there are many types of multiple sclerosis, the main 5 types include: Number 1, clinically isolated syndrome. The definition of this could be episodes of neurological symptoms that last 24 hours and cause inflammation of the central nervous system. The symptoms could involve sensory changes. The diagnosis could be an MRI scan, which can detect brain lesions. The diagnosis is that you may be at high risk of getting MS if the lesions increase. Therefore, if the MRI shows no lesions, then you are at a low risk of developing multiple sclerosis. Number 2, relapsing remitting multiple sclerosis is categorized by a positive attack of new or worsened neurological symptoms that is followed by periods of complete or part remission. The progression can be over time to a more progressive form of the disease. The prognosis could be variable. This is a frequent and severe decline that can vary from person to person. The treatment of this can be disease-modifying therapy, which can help reduce the occurrence and the severity of the relapses. Number 3, secondary progressive multiple sclerosis. The definition of this one begins as the relapsing remitting multiple sclerosis, as in number 2. But it then changes to a steady disease that develops and worsens over time, which could be either with or without irregular relapses. The prognosis of this is a gradual decline, and the rate of the progression can be varied, but overall, unfortunately, the disability tends to increase. Number 4, primary progressive multiple sclerosis is number 4. The definition is mainly a steady progression from the start, and is without early deterioration or remission. The symptoms can include mobility problems, such as difficulty in walking, and steadily get worse over time. Number 5, progressive relapsing multiple sclerosis is the last one. This is also a steady progression from the onset, but can have some deteriorations or acute attacks, and is the least common type. Development can continue to worsen with the occasional relapses. The prognoses can be a steady decline with attacks and an increasing disability. The treatment of all 5 of these different types of multiple sclerosis focuses on the management and how to slow the symptoms and progression down. Here is a general overview of the risk factors of multiple sclerosis. Number 1 is genetic susceptibility, which is influenced by genetic tendency. Several genes can be associated with the increased risk, This means that if you have parents or siblings with multiple sclerosis, you may have an increased risk. Number 2 is the environmental triggers, which can include various environmental factors, such as viral infections, especially Epstein-Barr virus, and vitamin D deficiency. If you smoke, you are at a significant risk for developing the disease, as it can worsen the disease's progression. Number 3 is immune system dysfunction. This could be an autoimmune response, where the immune system mistakenly attacks the body's tissues. The last factor is blood-brain barrier breakdown, or BBB dysfunction. This causes a defect in the vascular system that leads to impairment and reduced cerebral blood flow, which is related to dementia and neuronal degeneration. Symptoms. Multiple sclerosis has many symptoms that can vary from person to person and the extent of the damage to the central nervous system. The symptoms can also affect various parts of the body. The following is an overview of the common symptoms, including fatigue. You may have feelings of tiredness even though you have not done any activities. Number 2, muscle weakness. You may feel that you have a decrease in strength of one or more limbs, and that you may have difficulty in moving and doing easy tasks, such as opening a jar. Number 3 is your sensory symptoms may increase, such as you may feel numbness, tingling or pain, or you could have a sudden electric shock-like sensation that runs down the spine and limbs when you bend your neck. Number 4 could be problems with your vision, as multiple sclerosis may damage your optic neuritis, or you may have double or blurred vision or rapid eye movements. Number 5, cognitive impairment, means that the disease can cause memory problems such as trouble focusing or maintaining concentration. You could also have problems with planning, decision-making, and problem-solving. Number 6 is that you could have emotional and psychological changes. They could be depression, anxiety, or mood swings. The next one is that you may have bladder and bowel dysfunction, which means that you may need to go to the toilet more often, or have incontinence. You could also develop constipation, or loss of bowel control, but this is less common, but possible. Number 8 is a sexual dysfunction, which is a decrease in libido, erectile dysfunction, or females may have vaginal dryness. Number 9 is your speech and swallowing. You may have difficulty. After a while, you may slur or slow your speech due to your muscles getting weak. When you have difficulty swallowing, it can lead to choking. Other symptoms can include heat sensitivity, which means that if you are exposed to heat you may have something called Uthorph's phenomenon. Headaches and seizures, but this is rare but can occur. When your doctor or healthcare professional diagnoses your symptoms, it can involve many steps, which can rule out other conditions and confirm the presence of multiple sclerosis. The diagnosis is on a mixture of clinical tests, imaging such as MRI scans, and laboratory tests. The clinical tests can include medical history, neurological examination, which can help to show various functions such as your strength, and sensation function, which is your touch, pain, vibration, and temperature. Other tests could include magnetic resonance imaging (MRI) of your brain and spinal cord, which can show images of any lesions or plaques in the central nervous system. A lumbar puncture or spinal tap, which is a cerebrospinal fluid, can be analyzed. This is done if other tests show uncertainty. Another test is visual evoked potentials, which measures the electrical activity in the brain in response to visual stimuli. Also, somatosensory evoked potentials measure the electrical activity in response to sensory stimuli, usually involving the limbs. You may have blood tests, which can rule out other conditions such as infections like Lyme disease and syphilis, or diseases such as lupus, Sjogren's syndrome, and sarcoidosis. Another one is metabolic disorders, vitamin B12 deficiency. A test will be done to combine clinical, imaging, and laboratory findings to make the diagnosis. This is called the McDonald criteria. Treatment. The treatment of multiple sclerosis can become complicated as it can only manage the symptoms. As it is an uncurable disease, it is done by reducing the frequency of declines and slowing the progression of the disease. Treatment strategies include the following: disease-modifying therapy. symptomatic treatments, and lifestyle changes. Doctors may also treat the disease with corticosteroids that reduce inflammation and speed recovery. Methylprednisolone, Solumedrol, these are high dosages of intravenous administration for 3 to 5 days. They also treat your fatigue with an antiviral drug, or modafinil, which is a stimulant that can help with excessive daytime sleepiness. They could help you with your muscle weakness prescription for baclofen, which reduces spasticity. Another could be tizanidine for your muscles. Or you may be given an injection, called botulinum toxin. Other drugs that can help with your pain may include gabapentin, or Neurontin, and pregabalin lyrica, which are for neuropathic pain. For your cranial nerve, you may be given carbamazepine. For your bladder dysfunction, you may have oxybutynin, ditropan, or for nighttime, you may have desmopressin. With your medication, you must exercise. Doing low-impact exercises can help with improving cognitive functions. You may also be given antidepressants for your depression and emotional changes. Other treatments could be counseling and psychotherapy, rehabilitation and supportive care, physical therapy, occupational therapy, and speech therapy. Or changes in your lifestyle, which may include changing your diet and nutrition with a balanced diet that is rich in fruits, vegetables, and omega-3 fatty acids. For exercises, such as physical activity tailored to your abilities, go to a physiotherapist who can give you a tailored exercise plan just for you. Have some vitamin D supplements. This can help with deficiencies linked to this terrible disease. But always consult with your doctor before taking any supplements. If you are stressed, you could have techniques like yoga, meditation, and mindfulness. The last section is about how to live with multiple sclerosis. It has various symptoms that can make your life a big challenge, that can affect various aspects of your life. With a group of health care management such as strategy and support care, you can lead a fulfilling life. The next list shows you how you can live with this disease and how to manage the impact of daily life. Number 1 is physical health management. The first one is how to keep the symptoms from getting worse, which can include fatigue, spasticity, muscle weakness, and pain. Assistive devices can also help with your walking, such as canes, walkers, and wheelchairs. Or you could have home modifications such as installing grab bars, ramps, and stair lifts. Always keep up with your regular checkups with a neurologist to monitor disease progression and adjust treatments as needed. Consulting with urologists for bladder issues, ophthalmologists for vision problems, and physical therapists for mobility concerns. The second is managing the emotional and psychological symptoms. This includes mental health support, therapy, which can be psychological counseling or cognitive behavioral therapy. Support groups can also help. Try and join a support group. They can provide a sense of community, shared experiences, and emotional support. Or do stress management, includes relaxation techniques that include yoga, meditation, deep breathing exercises, and mindfulness can reduce stress and improve emotional resilience. Or get a hobby and interests. This can engage in enjoyable activities to maintain a positive outlook and mental stimulation. Number 3 is communicating with your family and social life, which includes talking about your multiple sclerosis and the impacts, to help build understanding and support. It can help your loved ones to understand the disease better. Number 4 is if you work, your workplace needs to be adapted to your needs, which could be flexible working hours, adjusting your workspaces, and using special chairs, keyboards, or voice recognition software. Number 5 is your lifestyle and wellness. This can include a healthy diet, eating a balanced diet rich in fruits, vegetables, lean proteins, and omega-3 fatty acids can support overall health. Supplements can help, especially vitamin D, as recommended by healthcare providers. You should also do regular physical activities. These are low-impact exercises such as walking, swimming, or yoga. They maintain strength, flexibility, and cardiovascular health. You should also work with a physical therapist to develop exercise routines tailored to your needs and limitations. The conclusion is multiple sclerosis can make your life very difficult, as the disease attacks your central nervous system, which can leave you with weak muscles, problems with your vision, memory problems, and much more, which can cause depression, anxiety, or mood swings. For diagnosing this disease, you could be taken for an MRI scan of your brain and spinal cord, which shows if there are any lesions or plaques in the central nervous system. You may also have blood tests and much more so that they can see how far your multiple sclerosis has developed. It is an incurable disease, meaning that the symptoms will get worse over time. So you need to keep active, have a balanced diet, do regular exercises, and go to support groups who are living with the same terrible symptoms. Also, you should keep all your appointments. Thanks for listening to this video. I am not a medical professional, and this video is for information only. If you have any worries about your condition, you should consult with your healthcare professional. If you found this video helpful, then please click the subscribe button to follow my channel and press the bell. If you have any questions, please leave a comment below, and I will get back to you. I hope this has helped you, and good luck.